If someone does find an error in their medical records, how can they go about having a correction made?
Well, number one, you would contact the source. Usually it would be your doctor or a hospital, or sometimes outpatient surgery labs. Contact them, ask them if they have a form to fill out. They're required under HIPAA laws to provide this strict methodology of correcting. You fill out the form, and the best way to get it corrected, instead of just saying this is wrong and writing it on the form, get a copy of the actual incorrect information, highlight it, and run a line. It makes it easier for the person that's actually doing the correction to do it, and it just ensures that it's done in the right way. The provider must act once they receive this form within 60 days. It's a very strict law. In certain circumstances, they can get an extension for up to 30 days, but the law is very strict on that. Sometimes a doctor will not correct a record. I'm trying to think of a situation, if somebody said, the doctor said they suspected alcohol intoxication or something like that, and they really felt that was the situation. They have to provide to you in writing the reason they are not correcting it. Or if you disagreed with the diagnosis and the doctor says no, that's what it is. You can appeal that, though, if the doctor or the hospital refuses to correct the record. You can file a formal complaint with the U.S. Department of Health and Human Services. There's a form right on the website that you can fill out, and then they'll take that up with the provider to make sure that it's adjudicated properly, and if it needs to be corrected, it can be corrected. There is also another Medical Information Bureau is a huge entity. It's been around for a long time, and it's sort of a central repository of everybody's health information. They too, and it's accessed by, say, health insurance companies or life insurance companies, and so hospitals and different things would access this information. So you have to make sure it's corrected there as well. And again, they have a website, Medical Information Bureau, and there's a form and a formal procedure, and again, strict time limits to respond to the corrections. So it's not just the provider. Sometimes once this information gets out, it's going all kinds of different places. So those would be the best areas to pursue to make sure everything is corrected.